So let's talk about healthcare for a moment. Healthcare has many valid approaches. Some involve a top-down Medicare for all method. Some involve a bottom-up free market method. Some involve both. All should account for innovation, including controversial ideas, to make healthcare affordable for all. Let's A/B test. So that is, and of course I hashtag that, Right to Try, because we put in the Right to Try Act that lets people in the United States try experimental medication when they are nearing the end of their life, and it might be the only, it's a terminal or dire situation, and the only way forward is for them to at least attempt an experimental medication. The right to try lets them try that out. It may have negative impact on them, but they don't have much time, and they need a breakthrough. So it's a cool thing that happened. So one of the main debates we're having right now, policy-wise, in the United States, and it'll be a major campaign issue in 2020 for the presidential candidates, is your health care, your Medicare for all, which is something that AOC and the progressive Democrats, the Justice Democrats, the Bernie-crat left in the country are pushing as one of their primary goals. Then you have the bottom-up free market idea. So this would be an idea where the insurance companies remain around, but we try to lower the cost of healthcare across the board from the bottom up, make goods and services in the healthcare industry cheaper, and add some innovation as well. You might want to have some of that social safety net kind of healthcare where people can afford it no matter what their income level is. You do want to think in a humanist mindset and a humanitarian mindset and take care of everybody that you can. So we might require some government health care for that reason. So at least some kind of public option. But you'll also want to definitely have lower drug prices. You'll want to have cheaper goods and services. And of course, innovation, including controversial ideas. So innovation might include technologies such as, and I'm not, I guess I'll pitch it because I'm actually on there as well. Interface by WenHub is a video calling app with monetization options for Android, iOS, and you can go to wenhub.com and of course sign up there. They have their own cryptocurrency called the Wen, which is doing very well right now. I didn't want to shill for WenHub, but they're really cool. They're partly owned by Dilbert creator Scott Adams, and I watch his videos. He's here on YouTube, Real Coffee with Scott Adams. So he talks about this quite a bit, how if you can consult with a doctor or a medical professional on WenHub, you can make a call that might be $100 an hour, $50 an hour. People can set their price from zero to whatever they like in terms of Wen tokens, the cryptocurrency, or USD, fiat, I think credit and debit and so forth. But basically, you'd be able to consult with a doctor over the phone and have a video call with them. And that would be one way to make getting a trip to the doctor, make it easier when you don't actually have to leave your own home, or even you don't have to go thousands of miles to see a certain kind of specialist. They can talk to you right over the video call and get paid for their work if they wish. So technology like that can certainly lower the cost of healthcare, and if the cost of healthcare is lower, it becomes more affordable. The a high tide lifts all boats, and basically people at the bottom floor that couldn't afford it before, they couldn't afford it, but once you lower the cost to a place that they can't afford or the government is happier to pay for, or the local state healthcare systems are happier to pay for, I think you'll find that that is just as valid a method as, taxing people more and more, and spreading that over an entire system that is guaranteed healthcare, universal healthcare. It's been also called single payer. So I like single payer healthcare. I think, though, we should look for methods that don't involve major tax increases and don't involve potentially creating more government bureaucracy. Now, there is a strong possibility that it would cut down on the amount of paperwork, because you wouldn't have to deal with insurance companies anymore. You'd be dealing with one place. You'd know how much everything costs. But, these are both valid methods. And I think that we should pursue both if possible, or at least explore. Maybe have, I think what it might turn out to be in the United States is it's probably pretty likely that the federal government will try to stay out of healthcare and leave it to the states that'll have their own individual liberty and be able to choose if they want to have state-sponsored healthcare, kind of like Massachusetts has Mass Health. So there's all different ways to handle that, but we do need to keep our eye on technology and the lowering costs of collecting blood samples, doing lab work, consultations with doctors through video calling and other similar methods. There are all these different ways, and I've only listed just a handful. So I just wanted to say that I am a bit agnostic. I'm not sure. I'd have to see a truly fleshed out approach, a truly fleshed out plan for Medicare for All before I could sign on to it. It's a beautiful idea. Other countries have had a good go of it, notably in Scandinavia with their socialized healthcare system. But I also do believe in the free market. I know that competition can drive down the cost of everything. So that's also a valid approach. We just have to make sure the insurance companies are kept fair, and they pay their claims, and they cover pre-existing conditions. Okay, I think that insurance companies can coexist with whatever system we create. If you want a different level of service. Oh my goodness, we have a cat. It's an outdoor cat. So sorry, only my cats are allowed to be on video here with me. We did have a video earlier where my cat Cindy actually jumped up. So hey, look for that. It's called Tweet. It was a fun video.